I think what's very exciting about the developments here at the World Oncology Forum is that we are looking at how cancer services can be integrated within the universal health coverage movement. And I really do think it's vital that not only cancer services, but other people interested in, say, maternal health services, palliative care, care of the elderly, are seeing that it's in our collective interests, sort of united we stand behind universal health coverage, and we'll all achieve the objectives that we want. And I think you're now seeing a lot of agencies like the World Bank, World Health Organization, international organizations, and even governments saying that the best way to achieve the health SDG is through universal health coverage. And universal health coverage being quite simply everyone getting the health services they need without suffering financial hardship. And of course, as the disease burden is shifting and sort of more sort of deaths due to cancer are occurring, it really should be the case that universal health coverage must include cancer services and the full range of cancer services, and also vitally palliative care as well. The issue of a global cancer fund is very, very interesting. I think that if we look at global trends towards universal health coverage, that by far the biggest amount of funding is going to come from domestic public financing resources. I think there are a number of big lower middle income countries now where the majority of people who don't get cancer services now live. If you think of India, Pakistan, Nigeria, Myanmar, Congo, these are countries, 100 plus million people that are actually spending only about 1.2% of GDP in public health spending. So I feel that even if we have a very successful global fund that raises a lot of money, that it's not really going to make much of a dent on funding cancer services in these big countries. Now, I do think there is a role, though, that using these funds wisely and maybe choosing, say, 3 or 4 issues, where there is a clear case for an investment in, say, global public goods, creating cancer registries, maybe procuring certain commodities that could be distributed to low-income countries that have got weak economies, plus funding advocacy, and I think supporting civil society organisations in these countries, not only to be lobbying for more money to spend on cancer services, but on health services in general. A global cancer fund, well targeted at supporting advocacy work, could really leverage a lot of public financing that will be beneficial for cancer, but also for other health services too. One very, very clear message out of universal health coverage is that it is dependent on public financing. You can't reach universal health coverage through private voluntary financing, user fees and private insurance. And so therefore I think it's very important that the oncology community, the cancer services community recognises that it's in their best interest to sort of join the movement for universal health coverage. And we can see that there are some very, very cost-effective cancer prevention measures, but also curative services too, that really ought to be in a package of services that's available for the entire population. So this notion that cancer services are too expensive and that the developing countries can't afford them is absolute nonsense. And it really should be the case that even low-income countries in their package of services that's available for the entire population should include some cancer services too.